Right. So today we'll be discussing OET listening part C. Okay. And listening part C, it is called presentation extracts or it is called interviews. Okay. So you may either, you can expect a presentation. Presentation means what? Presentation means just one person will be speaking. Okay, that is, it may be a healthcare expert, maybe a scientist, maybe a doctor, who will be giving one lecture for on one particular topic for 5 minutes continuously, and for that extract you will be getting six multiple choice questions. Or else you can also expect in interview. So what is an interview? Interview is a conversation between an interviewer and an interviewee. So it is a conversation. We can hear two people speaking, and there also they will be talking about one particular healthcare topic. So you have to listen to the audio, read the questions. For that also, you will be getting six multiple choice questions. You have to choose the correct answer. So in total, you have 12 questions over here in listening part C. And we'll be discussing a little bit about writing as well. So towards the end, I'll be talking a little bit about writing also, because just for 2 to 3 minutes, some listening guidance, writing guidance also I'll be sharing. Right. So today we'll be discussing about two different types of questions. Okay. So the first question type that we'll be discussing will be gist questions. Okay. Gist, or basically the main idea questions. Okay. So this is the question, first question that we will be discussing. So what are basically gist type of questions? Okay. So here your duty is to understand the overall intention. Okay. That is, you have to listen to the entire audio. Okay, and now what you have to do is you should be able to understand the central message. Okay, the overall message. Okay, the overall message, or the that is this is what we call as the gist of the message. Okay, so it is not one specific information. It is not one specific information. It is the entire information, the entire audio's information condensed into one particular information. That is what we call as gist purpose questions or main idea questions. So we'll be discussing that. Then we'll be discussing detail specific questions. So detail specific questions means one specific detail, just one. So over here, you see, here it is not one detail, it is all the details. In just questions, all the details, and that we can make it into one particular statement. But here in detail specific questions, they will be asking you to focus on just one particular fact. Okay, just one accurate factual information. Okay, so you have to spot. Okay, and of course you have to understand that there will be paraphrased clues, audios only. So they will not repeat the same words in the questions, in the answer options, in the audio. Okay, this is OET. Very rarely only they will be repeating the same words. So they will be using a lot of paraphrases, right? So we should be able to spot paraphrases and synonyms. And then we'll be talking about keyword analysis, because you need a very sharp mind. Okay, so it is through the keyword analysis you understand what type of question you're dealing with, whether it is a main idea question, whether it's a detail specific question, right? And also it will help you to choose the correct answers as well. Okay, I'll be talking about how to eliminate the incorrect answer options, how to avoid distractors. So keyword analysis we'll be doing today. And again, distractors. See, it is a 5 minute length audio. So, okay, so one extract is for almost 5 minutes. And in this 5 minute audio, we have only six questions. Just six questions, and we have full 5 minutes. So what does that mean? That means most of the audio there will be distractors. Okay, so just six tiny information from a 5 minute audio. So that means what? More than 4 minutes of the information will be distractors. That is, it will not be the answers we are looking for. So you must know. So that ability to discriminate. Okay, that is, you should be able to discriminate like which information is useful to you and which information is useless to you. Okay, so that you will be able to develop if you're able to do the keyword analysis properly. So avoiding the useless information, knowing, okay, I'm hearing this information, but this information is not what I'm looking for. Okay, avoiding distractors. Okay, so this will help you to, eliminate the incorrect answer options that are just trying to confuse you, and also to stay focused. Okay, like how to stay focused and not fall for the traps. Okay, so distractors are basically traps, and we should be very careful to not fall for them. Right. And then maintaining focus for long extracts. Now you see over here, you are doing listening part A, then you're doing listening part B, and then you're doing listening part C1, extract 1, and then you're doing listening part C2. So do you think you will be having the same amount of energy in listening, that is in the end of the listening versus the beginning of the listening? No. In the beginning of the listening test, you had full brain capacity. Towards the end of the listening, you don't have full brain capacity. You're a little bit tired, you're a little bit exhausted. Right. So it is very difficult for you to focus. It is very difficult for you to concentrate on the questions and the audio. But your ability to maintain focus. See, it is not, now this is not at all related to your language proficiency. You can be very good in English, but if you are having very low attention span, then it is going to be very difficult for you to find the answer. Okay, so maintaining focus, and I will tell you how exactly that is done. Okay, active listening skills. Again, note taking strategies and all will be coming over there. And the elimination strategy. Because why most of the questions, so we have 12 questions over here. All the 12 questions are multiple choice questions, right? And for each question, there will be three answer options. At least one incorrect answer option if you're eliminating, then you have 50-50 chance, right? So there are three answer options. If you're able to eliminate just one, then you have just two answer options. Right. And now it is a 50-50 chance. Now, if you're lucky, okay, now if you're lucky, even if you don't know the correct answer, if you make a guesswork also, because you have eliminated one correct answer, and if you're a little bit lucky, you can still choose the correct answer option. So elimination strategy is very important. And at least one you should be able to eliminate very, very easily. Right. So this and all we'll be discussing in today's session. So let's take a look into the question paper that we'll be discussing today. Is it this one? Yeah. Okay, so this is a Cambridge University OET listening. So as you can see over here, this is how the very first page of your OET listening looks like, and this logo. So every single material that you get from our institution is always going to be Cambridge materials, right? So these are the official OET original exam materials, right? And the skills. Okay, so when it comes to OET, it is not simple language proficiency. So let me just tell you, a businessman or an engineer or an artist or a painter or someone else who is not in the medical field, if they have very good language skills also, they will not be able to clear the OET very easily. Because why? OET is not a English exam. Number one thing you need to understand this. OET is not a language exam. It is an exam that has been designed exclusively for medical professionals, right? So as a medical professional, you need to have certain skills. Okay, your brain should work in a very specific manner. Okay, and those skills are being tested by the OET, and only the Cambridge University materials have been designed to test you on those skills. Simply practicing random materials from YouTube, from other institutions and all that, they will only improve your language. Okay, and language improvement is not the only factor that is improvement important over here. Okay, so this is a Cambridge University material, and it is termed as Andrew Taylor. So all these you can get it from the Google Drive. The recorded lectures are also available in the OET exam mastery app. We have given you 24/7 access to them as well. Right. So here there will be 24 questions in listening part A, fill in the blank questions, and then there will be 6 questions, multiple choice questions in listening part B. And now you can expect 12 different questions in listening part C, right? So listening part C, as I told you earlier, it is either a presentation or interview. So presentation means just one person speaking. Interview basically means two people speaking, okay? An interviewer and interviewee. So here it depends upon your luck. Maybe you can expect one presentation and one interview. So maybe extract one, maybe a interview, and extract two may be a presentation. Sometimes both extracts may be a presentation, or both extracts may be an interview. Okay, so regardless of what you get, you should be able to give your best performance. Right. So everything over here are multiple choice questions. So with your pencil, a 2B pencil, if you choose answer option B as the correct answer, then this is how you should shade it. Okay, you should just simply shade answer option B like this. That is the instruction over here. So let's see what we are dealing with today. So here, what is our extract over here? So it is a presentation. Okay, you hear a presentation by a cancer specialist. Okay, as specialist cancer nurse called Sandra Morton. Okay, so this is a presentation. Means just one person will be speaking. You will not be hearing a second voice who's talking about her work with prostate cancer patients. Okay, including a man called Harry. Okay, so this is what is happening. You're hearing a presentation by a cancer specialist nurse called Sandra Morton. And what is the main theme of her topic? She's talking about prostate cancer, especially a case called Harry. Okay, and you get 90 seconds time to read questions number 31 to 36. Now, the OET, I must say we should really appreciate the OET because, compared to IELTS, compared to TOEFL and all that, which has a lot of different types of complex questions, confusing questions. Here, the OET has just given you one specific type of question. And what is it? Multiple choice question, just one. Okay, part B, multiple choice questions, part C, multiple choice questions. So we should be really grateful to OET. And on top of that, they are giving you 90 seconds time as well. Okay, they are giving you 90 seconds time for you to read the questions. That is, before the audio plays, they give you 1.5 full minutes to read the questions 31 to 36. So that is another advantage. So the OET really wants you to succeed. Okay, they're really rooting for your OET success. So what we must do, okay, what we must do is that utilize this to our advantage. Now, see, the main reason why you get 90 seconds time to read the questions is to mentally prepare yourself. Okay, so this is the reason why. Otherwise, they can simply, okay, as soon as they can just simply say, okay, this is listening part C, extract one, and maybe within 10 seconds, they can just play you the audio. But here they're giving you 1.5 minutes, okay, before the audio plays. And why is this done? For you to mentally prepare yourself, okay? And the best you can do is to utilize this 90 seconds as an investment. Okay, it should be an investment of time. So what do I mean by investment? That is, after these 90 seconds is over, that is when the benefit should come. So you must spend this 90 minutes. Okay, how should you spend the 90 minutes? You must spend this 90 minutes such that after the 90 seconds is over, the benefit comes. Okay, so simply don't waste these 90 seconds. Okay, so if you're simply wasting the 90 seconds, not using it very properly, right? Then what happens is after 90 seconds, when the audio is going to play, you will not get the maximum benefit. Okay, so there are two methods of reading. Okay, so some students, what they do is they just simply read, okay, 31st question. They read the 31st question. What does Sandra Morton see as the main aim in her work? A, to inform patients about the different treatments, to publicize the availability, to raise, like this, they will just simply read, okay? They will not give any importance to the keywords. They will not give any importance to the question type. They will just simply, for the sake of reading, they will just simply read 31 very quickly. And then they will read 32 very quickly. 33, they'll read 34, they will read 35, they will read 36, they will read. And then they will still have some time left. Okay, and then once again, okay, so maybe within 45 seconds I'll read it one single time, and then the remaining 45 seconds once again, what they will do, they will simply read 31, 32, 33, 34, 35, 36. Now what happens is, you will, so when a student is reading like this, and remember, you are not doing listening at home, you are doing listening part C in an examination hall. Okay, so there is exam nervousness, there is exam anxiety, right? And you may have done mistakes in listening part A, may have done mistakes in listening part B, right? So you're a little bit frustrated, right? And also you're a little bit tired as well. Listening part A took a lot of energy. Listening part B took a lot of energy. So now you're in listening part C. So you have very limited energy. Okay, you have very limited energy, and also you are a little bit stressed. You're a little bit anxious. So in that state of mind, if a student is simply reading 31, 32, 30, 34, 35, 36, what is going to happen? Nothing is going to happen. That means they simply wasted the 90 seconds. Okay, they did not register anything into their mind. So when you get 90 seconds, the OET is giving you the, again, remember the OET is trying to help you. Okay, it is they are giving you to relax, to think very clearly, to mentally prepare yourself, right? So with a very cool, calm mind, you read the 31st question with high quality. Okay, so let me just write this over here. When it comes to OET, always remember that quality is more important than quantity, right? So you can read one information 3, 4, 5 times, but if there is no quality in what you read, then the quantity does not matter. But on the other hand, if you're reading the question just one single time, but that one single time you're reading with good quality, you're putting in effort, you're putting in, stress, and you're really, decoding, you're analyzing the information, that means there is a high quality reading going on. So what will happen is that you will get a more benefit. So this is how you should spend the 90 seconds. It should be a quality spending of time, and it should be an investment of time. You should invest this 90 seconds such that when the audio is going to play, you get a maximum benefit. Right. So when you get the 31st question, instead of simply rushing through, okay, don't put yourself into stress mode. The OET will put you into stress mode. The OET will push you into nervous mode. Okay, that will definitely happen. Right. That is definitely 100% going to happen. So you don't be your own enemy. Okay. Don't be your own enemy and don't put yourself into high pressure situation. Cool yourself down and just read with an intent, read with a clarity. Okay, what does Sandra Morton see as the main aim? So with a small pencil, you just, underline the keywords, and then to inform the patients, to publicize. So like this, as you're reading, just underline the important words, underline the important verbs, keywords, make some notes, and then you go to the 30-second question. So what happens is you get a lot more memory. A lot of memory is registered into your mind, and this memory will definitely help you to crack the questions much more easily. Okay, so all these are very important strategies. So I will be discussing two types of questions. Okay, so I'll be discussing, detail specific questions as well as gist type of questions. Okay, so this is the very first question over here. That is the 31st question. So this is a gist type of question. So before I give you the coaching and the teaching, I want you all to read the 31st question, identify what type of question it is, identify the keywords, identify the verbs or the stems, the question stem or the focal point of the answer options, comprehend the question. Comprehension means what? Understanding the question. Then retain, okay, register the information to your memory, okay, and then I'll play you the audio and you try to choose the correct answer. Type your answer in the chat box. Those who are already done the reading, listening material, you may already know the answers to all the 42 questions. But just because you know the right answers to all the 40 questions, simply don't type the answer in the chat box. No, find the answer on your own, have a thorough clarity on it, and then you type your answer in the chat box. So everyone, read the 31st question. Okay. So let's just take the audio script. Just give me a second. Okay, so I'm going to play the audio now. Symptoms of the illness. Now, let's hear the audio script over here and let's see if you can find the correct answer.
My name's Sandra Morton, and I'm a specialist cancer nurse, helping cancer patients deal with their diagnosis and treatment. I'd like to tell you about the type of work I do, and particularly about one of my patients, recently diagnosed with prostate cancer. Let's call him Harry, to illustrate the sort of things I get involved with. Now, before we get on to Harry, I'll give you a bit of background. Clearly, my job covers many aspects of patient care, but what's the priority? Firstly, prostate cancer is in fact the most common cancer in men in the UK, with over 40,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating. Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective.
All right. So that was the audio script. Now we have actually, so do you know the answer? Is it A or B or C? All right. Okay, we have a few suggestions coming over here. Right. So what type of question is this? So let's understand the question type. Okay. So this is the question. Let's read the question over here. Okay. And what we're going to do is read the question just once. So very quickly, I will be just reading the question and then let's see what the other things that I have prepared. One second. All right. So the question over here is, what does Sandra Mountain see as the main aim in her work? So what is the question stem? Question stem basically means the focal point of the question. Okay. The main part of the question before the answer options. So here your duty. So what is the duty over here? Your duty over here is to find what according to Sandra Morton. Okay. That is according to Sandra Morton. Okay. What is the main aim in her work? Okay, main aim means what? The main goal. So she's doing a job, she's doing a work, and according to her, what is the number one priority? Okay, what is the main intention of her work? This is your duty. So your duty is to find what is the main objective, the main goal of her work. Okay, now you have to train yourself. Now you have to train yourself to listen only to that and to avoid the distractors one by one and also to eliminate the answer options one by one. So let's take a look into the answer options over here. Answer option A. So what are answer options A, answer option B, and answer option C? Answer option A, answer option B, and answer option C's are all potential main aims of a work. Okay. Okay, so maybe A could be the main aim of our work, B could be the main aim of our work, or C could be the main aim of our work. Okay, but among these three, we have to find the right one. So let's take a look into the first answer option over here. First answer option is this one: to inform patients about the different treatments on offer. Okay, so what is the keyword over here? To inform. Okay, the main aim is to inform patients about the different treatments, okay, on offer. All right. So what is the second thing over here? Second option, to publicize the availability of test for the condition. Publicize basically means what? Publicity. What does publicity means? Advertising. Okay, advertising. So what is the main intention of a work? To advertise or to, promote publicity. To promote publicity about the availability of tests for the condition. Okay, so what's the condition? Prostate cancer. So regarding prostate cancer, there are so many tests available, and what is her duty? Her main intention is to advertise or to promote publicity regarding the test available for the condition, that is prostate cancer. Okay, this is information. First one is to provide information about the different treatments. And C option, to raise awareness. Okay, so here her duty is to raise awareness of the symptoms of the illness. Right. So this is how we do the keyword analysis, or we can say the comprehension strategy. Okay. So step number one is comprehension. Okay. Because what is comprehension? Comprehension is basically understanding the question, understanding your duty. So if you don't know, if you don't have clarity in what your purpose is, then there is no point in listening to the audio because you will only get more confused. Okay, so to get clarity here, you definitely have to comprehend the question. right? And for this, you need to do the keyword analysis. So interact with the question paper, take your pencil, underline, highlight, do everything like this, make some notes. Everything is allowed for you to do, right? Then comes retention. And what does retention mean? Retention basically means registering the information to your memory. So once you have understood the entire thing, you should not forget what you have understood, right? So you must have a clear memory of the question into your mind. And when the audio is playing, where should your eyesight be? When your audio is playing, your eyesight should only be in the answer options. Okay, during the audio, you must not read the question. Okay, when the audio is playing, do not read the question because the audio is going to distract you. Okay, the OET is trying to distract you. You must not distract yourself. Okay, so the clear memory of the question. So, what is Sandra Morton's main aim in her work? That memory should be there. And when the audio is playing, your eyesight should only be in the answer options. Okay, so that is what we call as retention. And then comes detection. Okay, detection basically means to pinpoint the correct answer, and that includes the elimination strategy. Okay, so choosing the correct answer is important, but even more important is knowing why this is an incorrect answer option. So if you believe maybe A is incorrect, then you should know why B and C, if A is correct, why B and C is wrong. Okay, that clarity also is important. And for elimination strategy, the verb analysis. Okay, the verb analysis will definitely help you to a great extent. Right. So what question type is this? Okay, so let's take the document that I have prepared for you over here. The first question, and then we will go to the audio script. So this is a gist or main idea type question. Okay, so they are asking you. So here they are not asking you one specific topic. Okay, that is, see, when someone is talking about their work, they're talking about this is my main idea. Okay, this is my main aim of my work. You have to listen to the entire thing. Okay, so that is the central message over here. Okay, so this is the gist purpose or main idea type question. Okay, that is basically you need to understand the overall, okay, the overall aim or overall intention. So it is not going to be one specific information, right? So see over here, what is the main aim? What is the main focus? What is the overall point? So if you come across these type of words, you can say that this could be a gist type of question. Now, what is this question checking you upon? This type of question is checking your understanding of the general purpose. Okay, that is, you have to listen to the speaker and not only the speaker's words, but the perspective of the speaker. So, see, when a person is saying, this is my, when a person is speaking, they will not say, this is my main aim. They will not repeat the same words in the question in the audio. Okay, but you have to understand, okay, this is the priority of the person by giving importance to the perspective. Okay, so you have to think from the perspective of the speaker as well, and then find out, okay, this is the overall message of the overall point of the speaker's message. Okay, so you should be able to grasp the bigger picture, not just facts require you to summarize the speaker's goal or motivation. Okay, so I'll just send this document to you later on. Now, let's just do the verb analysis, and then let's take a look into the audio script over here. So let's identify what are the verbs over here. Okay, so your duty. So what is your duty? To find the main aim in her work. Now, what are the verbs over here? Verb means what? Any kind of an action. Any kind of an action, any kind of a movement is what we call as a verb. So what is the verb in answer option A? To inform patients. Okay, so informing. Okay, don't you think informing is an action? Yes. So what is the main aim of a work? To provide information. Okay, providing information to patients is the main aim in a work about the different treatments. So that's the keyword. Now, what is the verb in answer option B? To publicize. Okay, so here, what is the verb over here? To advertise, to market, okay, to increase publicity, okay, making people know that there are many tests available for prostate cancer patients. Right. So to publicize, okay, promoting publicity is the main aim of a work. First is to provide information. Second one is to publicize. Now, what is the third verb over here? To raise awareness. Okay. So what is the person doing over here? Increasing awareness. Awareness means knowledge. Okay, so the person is trying to increase knowledge and increase wisdom about the symptoms of prostate cancer. So that is the main aim of her work. Okay, and she is a specialist cancer nurse. Right. So now you see, now you have condensed the very big answer options into small answer options. Okay, the main aim is to provide information, the main aim is to publicity, okay, publicize, and the main aim is to increase awareness. Okay, and then you have a small memory of the keywords as well. But you see, now it is much more tinier, and this tiny information will make it even more easier for you to eliminate the incorrect answer options and choose the correct answer option very quickly. Right. So let's take the audio script over here. So this is a little bit of a lengthy audio script. So let's take a look over here. The main aim of Andra Morton extract one. Okay. All right. So let's just read. Let's just read the audio. So we have already played the audio. Let's just go through the answer, the audio script. So she is saying, my name is Sandra Morton, and I'm a specialist cancer nurse. Okay. Cancer nurse helping cancer patients deal with their diagnosis and treatment. Now, what is this information? This is just an introduction. Okay. My name is Sandra Morton. And what is she doing? She's a specialist cancer nurse. Okay. What is she doing? She helps cancer patients. Okay. Regarding their diagnosis and treatment. Now, see over here, this is a distractor. This is just an introduction, right? That is, she's just telling, okay, she's just telling what my name is and what my work is. I'm a specialist nurse. But what is your duty here? Your duty is to find what is the main aim of her work, okay, the main objective of her work. So this is not what we are looking for. So let's just keep on going through. I'd like to tell you about the type of work I do. Now she's talking about the type of work I do, and particularly about one of my patients recently diagnosed with prostate cancer. Let's call him Harry. So now she is talking about Harry and how he is a patient with prostate cancer to illustrate the sort of things I get involved with. Now, see, she is using Harry as an example. Illustrate means what? Example. Okay, she's using Harry as an example to explain the sort of things that she is involved with. Okay, so this entire thing over here has nothing to do with the main intention of her work. So you must be able to understand, okay, this is just an introduction about her name, about what she does. The main aim of her work, the main goal of her work is yet to come. So let's keep listening. Now, before we get on to Harry, I'll give you a bit of background. Now, see, now she is going to talk about the history. Background means what? Background information, history information, right? Now she's going to talk about little bit history. So clearly, my job covers many aspects of patient care. So she's saying her job, it covers so many different parts of patient care. But what is the priority? Now, see this word over here. This word over here is when you should become alert, because what does priority mean? Priority basically means the main aim. Okay, so the main intention or the main thing is what we call as priority. So what is all of your priority? OET success is your priority. Okay, so your main main thing in life currently is OET success. So that is what we call as priority. So as soon as you hear this word, you should become alert. Okay, now she's asking, okay, now she's going to tell about the main priority of her job. Okay, so now let's see. So firstly, now she's saying, okay, so again, this is a background information she's telling about. She's telling prostate cancer is in fact the most common cancer in men in the UK. Okay, so this is the most common cancer with over 40,000 new cases diagnosed every year. So she's telling again the background information. There are 40,000 people with in UK itself every single year. That is a staggering number. Staggering means that is a very enormous, surprising number. One problem, now see, one problem is that this type of cancer actually develops very slowly. Now she is saying this cancer is not very sudden. The development, the trajectory of the disease happens very slow. So there may be absolutely no sign that you have it for years. So what is she telling? This is a disease that is very common. But the problem with this disease is that the trajectory, the development of the disease is very slow. So since it is very slow, in the maybe the first year, the second year, the third year, there will be no sign, there will be no symptom. Right. For many years, there will be no sign or symptom in the patient. Okay, so that is why many people don't realize that they are having prostate cancer. So if you are going to reduce the number of cases, so she's saying, so in the future, now she's talking about the future. So if we want to reduce the number of cases in the future, okay, right now we have 40,000 cases presently. In the future, if we want to reduce it below 40,000, it is vital. Now, see, vital is what? Vital means another word for main. Okay, very important. It is vital that people like me. Now she's talking about herself. Okay, so it is important that people like herself get the word out. Now, see over here, this is a colloquial phrase. Okay, get the word out, basically that is a figurative speech as well. Okay, the word basically means the information. Okay, information to as many men as possible. Okay, so what do you think what do you think the information is in from the three answer options? To raise awareness. Okay, to raise awareness of the symptoms of the illness. Okay, now you see over here, that is what she's saying. So she's saying the signs, the symptoms of this disease, it says dormant. Okay, it is dormant for several years. No one realizes it. So we need to, yeah, sure, you can leave. Okay, so now, okay, so now she is saying, okay, if we want to reduce the number of cases, it is important that people like herself get this information out to as many men as possible. That is what raising awareness. Okay, so that is the main thing, that we tell them how to spot the signs of prostate cancer. Now you see over here, like increased need to urinate, straining while urinating, and etc. Now you see over here, this part of the information, okay, just look very carefully over here. This part of the information to get the word out, okay, get the word out to as many men as possible. Okay, so what is this verb over here? This verb over here is answer option, in C answer option, this one. Okay, to raise awareness. Okay, so raise awareness is mentioned. Okay, don't you agree? Okay, raising awareness. But there is another part of the answer option that is still remaining. What is that? The symptoms. So about what is she trying? About what is she trying to spread awareness? She's trying to spread awareness about the symptoms of the illness. So symptoms we have not yet read. So let's see, let's confirm whether they are going to talk about the symptoms. Okay, now you see over here. Okay, now you see the symptoms. One by one, you can see that she's going to be talking about the symptoms, right? Now she's going to say about the signs. Okay, signs basically means what? Symptoms of prostate cancer. Now see, like an increased need to urinate. That is symptom number one. Okay, increased need. That is, people feel like they need to urinate very more frequently, or straining. Okay, straining while urinating. That is having difficulty when urinating. Okay, so these are the two main type of symptoms. And what is her duty? People like me, people like herself, the main duty, it is very vital that she actually spreads information to as many men as possible. Okay, so what you can do, you can put a very strong question mark over here, because the keywords are mentioned, right? So you take your pencil and you can put a question mark, because why? The keyword, the verb over here, raise awareness. Okay, the verb is mentioned, and along with that, the keyword as well. Okay, what is the keyword over here? Symptoms of the illness, everything is mentioned. Okay, and that is also the main aim. So we can almost say with a certainty that C is the correct answer, but for the time being, you can just put a question mark. You highly suspect that C could be the correct answer. Right. So now let's keep reading the remaining part of the audio script. Now here she is saying, unfortunately, okay, say unfortunately, the cancer can be at an advanced stage by the time patients come in for tests. Now see, now she is once again, she is reinforcing the statement that when people come for test, the cancer may have reached an advanced stage, at which point the available treatments are far less effective. Now see over here, available treatments. So this is the main keyword over here. Okay, and in which answer option did we read about available treatments? Okay, so now your eyesight should go to answer option B. Okay, now here they're telling what is the message over here? When cancer patients, they come to the clinic, okay, it is already at a very, very advanced stage, okay, at which the available treatments are far less effective. So over here, the treatments, so there are many treatments available, but unfortunately, all those treatments are not going to be effective because why? It is at an advanced stage. Okay, so if it is little bit early, if they had come little bit early, then maybe the available treatments could have been better. Right. So over here, treatments. Okay. Now see over here, the first keyword over here is available treatments over here. Okay, so this is mentioned. Okay, the different treatments are mentioned. This keyword is mentioned in the audio, but more importantly, what is the verb over here? What is the verb over here? To inform patients, right? So do you think that the main aim of Sandra Morton is to provide information to patients? No. Okay, she's telling about treatments. What is she saying? People with advanced stage, when they come, the different treatments, they are less effective. Okay, they're talking about treatments being less effective, and there is nothing about providing information to patients. So this verb over here is not at all mentioned anywhere. So you should be, so since this is not mentioned, answer option A is eliminated. Right. Now let's take a look into B option over here. So what is the verb over here? To publicize. Publicize basically means what? To advertise, to market, to increase publicity about the availability of test for the condition. So we did not read anything about the different tests that are available, right? So this is not at all mentioned. Publicity is not mentioned. Different tests available for this condition, that is also not mentioned. So B is also eliminated. And we have a very strong suspicion that answer option C is the right answer, because the verb over here, raise awareness, because why? This is very dormant. It takes a lot of time for the disease to progress. So it is someone has to go and spread information. Okay, so symptoms. So what are the two different symptoms? Straining. Okay, straining when urinating, as well as frequent urination. Okay, so these are the symptoms. So if people know, okay, these are the symptoms of prostate cancer, then in the very beginning itself, they can go to the clinic and they can save their life. Okay, there is no need for them to wait until it reaches the advanced stage. So this is what she is trying to say. So to raise awareness regarding the symptoms of the illness. So answer option C will be the right answer. Okay, so C is little bit directly mentioned over there, and at the same time, it is very easy for us to eliminate A as well as B as well. Right. So let's just play the audio once again, just to solidify it, and then we will go to the next question. Right. So let's just take the audio one single time. So this time you just focus on the distractors and make sure that you're able to eliminate the incorrect answer options one by one.
My name's Sandra Morton, and I'm a specialist cancer nurse, helping cancer patients deal with their diagnosis and treatment. I'd like to tell you about the type of work I do, and particularly about one of my patients, recently diagnosed with prostate cancer. Let's call him Harry, to illustrate the sort of things I get involved with. Now, before we get on to Harry, I'll give you a bit of background. Clearly, my job covers many aspects of patient care, but what's the priority? Firstly, prostate cancer is in fact the most common cancer in men in the UK, with over 40,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating. Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective.
All right. So that was the audio script. Now we have actually simplified that particular audio script. So, all right. So that's clear, right? Okay. So again, the detailed lectures are already available in the app. You can always feel free to just open the app and just, check through the slides over there. All right, so now let's take a look into the 32nd question. Okay, so this is going to be a detail specific question. Okay, that is one specific detail they're asking you. So read the 32nd question, do the keyword analysis. Just give me one tiny second over here. Let's take the audio script. As you can see, all very detailed lectures, slides, all available. Okay, read the 32nd question. So let's play the audio. Hear the audio.
So, let me tell you a bit more about my patient Harry. Like many middle-aged men, Harry was offered a routine health check at his local doctor's surgery. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. But he promised his family he'd look after himself. His wife had died of ovarian cancer some years before, so he felt obliged to go. It was during his appointment that, based on a few symptoms he mentioned, Harry's doctor decided that he'd need further investigation for prostate cancer and referred him to a specialist clinic at the hospital.
Okay, so that is what the audio. Should I repeat it just once again? Because it's a slightly tricky question. Okay, that's what answer option C is telling us. Now let's hear the audio.
So, let me tell you a bit more about my patient Harry. Like many middle-aged men, Harry was offered a routine health check at his local doctor's surgery. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. But he promised his family he'd look after himself. His wife had died of ovarian cancer some years before, so he felt obliged to go. It was during his appointment that, based on a few symptoms he mentioned, Harry's doctor decided that he'd need further investigation for prostate cancer and referred him to a specialist clinic at the hospital.
Okay, so that is what the audio script was telling us. So what could be the answer? Is it going to be A, B, or C? So let's do the keyword analysis. Okay, so this is, I would say, a medium difficulty question. Okay, so it's not too easy over here. It's a slightly difficult question over here. All right, so let's take a look into the question. Okay, good. When Harry was offered a routine health check, okay, so the patient over here is Harry. So what was the patient offered? She was offered a routine, okay, that is a regular routine health check. That is local surgery. He initially, okay, that is, he got an offer. Okay, now see over here, it is just an offer over here. See, each and every word is important. Okay, the checkup has not yet begun. The checkup has not even started. The medical staff is just offering, okay, we are willing to give you a health check. Okay, health checkup. So as soon as he heard, as soon as he got the offer, what did he do? Initially means what? Starting, the beginning. Okay, so in the beginning, as soon as he got the offer, what did he do in the very first stage? Okay, so what did he do? Answer option A, B, or C. So let's do the keyword analysis by reading the answer option A. So answer option A is he initially resisted the idea due to his wife's experience. Okay, now resistance. Okay, resist means what? So those those who are doing OET speaking. Okay, OET speaking. What does the word resist basically mean? Can anyone type the answer in the chat box? Resist. Resist basically means to decline, okay, to oppose something. That is what we call as resistance, okay. When you are not welcoming it, but you're basically opposing it, okay, you are declining certain things, what we call as resisting something, okay. So when he got this offer, he resisted the idea, okay. What idea? What is the idea over here? To go for health checkup, okay. So he resisted the idea. And why? Because of his wife's experience, okay. So his wife had maybe an experience, and it was not a positive experience, maybe it was a negative experience. So because of that he was not ready to undergo the health checkup, okay. This is what answer option A is. Okay, clear? Now let's come to answer option B. Again, every word over here is important, right? Now let's see what he did when he was offered the health checkup initially. He felt that he was too fit and well in need of it. Okay, so what did he say? So as soon as the medical staff offered him, okay, you can attend a free health check. He said, no, no, I am very fit. Okay, I am very healthy. I am very fit. I am very well, and I don't need this health checkup. He's saying, no, I'm very good. I'm very fine. I'm 100% healthy. I don't need any kind of thing. So here also, what is he saying? It is resisting. Okay. He is resisting it, right? Don't you agree? He is resisting the health checkup. But what is the reason? He is not resisting it because of his wife's experience. This time, answer option B also, he is resisting. Okay. But he resisted. Why? Because he feels he's too healthy. He says he does not have any problem in his health. So he's saying, I'm super fine. I don't need this particular thing. All right. Now let's come to answer option C. What did he do? He only agreed. So here he is agreeing. So here he is not resisting it. He is actually saying, okay, I am ready. Okay, I agree to undergo the health checkup. But only means what? Just one. So there was only one reason, only for one single reason, he agreed to attend this health checkup. Okay, so only agreed to attend because his doctor advised him. Okay, so his doctor advised him, so only because of that, not because he is worried about his health or he is having any symptoms, not nothing that of that sorts. Only reason why he is agreeing to attend this particular thing is because his doctor advised him to. Right. So like this, we have to comprehend the question. Now let's do the verb analysis. Okay. See, what is your duty over here? Your duty is to eliminate the incorrect answer options and choose the correct answer option, right? So that is why elimination strategy is very important. So what is the stem of the question over here? The question stem. Okay. Okay, what did he initially do when he was offered this health checkup? Okay. So first, what is the action over here? The action over here is resistance. Okay. So he resisted the idea. Okay. That is, he resisted the health checkup. So this is what he initially did. Okay. Now, what is the action or what is the verb in answer option B? He felt. Okay, so he is feeling. So that is the thing. He felt that he was too fit and well. So we can say this one. Okay, so he is feeling. He is feeling too healthy. He is feeling too well. So he's resisting it. Okay, so he's resisting it. Why? Because he feels too healthy. He's saying there is nothing wrong with me. I'm super fine. Okay. Now, what is the action? What is the verb in answer option C? Agreeing. Okay. So here he is agreeing. Okay. So he is agreeing to attend. Okay. But there is only one reason why. Why is he agreeing to attend? Because his doctor advice. Only because his doctor advice, he is agreeing to attend. Now you see, very long, lengthy sentences is now much more shorter. So he resisted the idea. He was feeling too healthy, and only one reason why he agreed. Okay, now don't you think it is much more easier? Now what you should do is when the audio is going to play, okay, now when the audio is going to play, you should look only into the answer options. Okay, now your eyesight should only be in the answer options. The memory of the question should be thorough. What is the question asking you? The question is asking you when he was offered this particular health checkup, how did he react initially? That is thorough in your memory. That you should not forget it. Okay, that should be imprinted in your memory. And with that in your memory, you need to read A, B, and C. All right. So let's take a look into the audio script over here. Just give me a second. All right. Okay, so we have listened to the audio 2 times. So let's read the audio script now. So let's see what the cancer nurse is saying. So let me tell you a bit more about my patient Harry. Okay, now she is talking a little bit about patient Harry. Like many middle-aged men, so middle-aged basically means 50 years. Okay, so between 45 to 55 is what we call as 50. 50 is what we call as middle age. Like many middle-aged men, Harry was offered. Okay, so now the question keyword is coming. Harry was offered a routine health check at his local doctor surgery. As far as he was concerned, he had no particular health problems. Now, see over here, as far as he was concerned. So he beginning itself, okay. So they are talking about the offer. He was offered a routine health checkup, okay, and according to him, he had no particular health problems or obvious symptoms at that time. So he almost ignored the invitation, right? So what is he saying? He felt that he had no health problems. He felt that he had no symptoms. So he almost ignored the invitation. That is the routine health checkup. So where did we read all these things over here? We read it over in answer option B, right? He felt he was too fit. He was too fit in need of it. Okay, and that is why he almost ignored the invitation. So what you can do? You can put a question mark over here because you highly suspect that answer option B could be the right answer. The verb is mentioned much more clearly. Right. So let's keep reading this thing over here. Yeah. But he promised his family he'd look after himself. Now, see, what is the remaining part of the audio script saying? But he promised his family. So he promised his family that he would look after himself. His wife had died of ovarian cancer some years ago. Okay. So he felt obliged to go. Now, see over here. Now, they are talking about the experience of the wife. So, what was the wife's experience? The wife had ovarian cancer, okay, and she died because of it. She had ovarian cancer and she died because of it several years back. And because of that reason, because his wife had this negative experience, he obliged, that is, he agreed to go. Okay, obliged basically means, not willingly. Okay, so even though he is not fully willingly, because of this reason, he was basically ready to go. Now, what is answer option A? Answer option A is telling he resisted the idea due to his wife's experience. No, because of his wife's experience only, because his wife had ovarian cancer and because his wife passed away, because of that reason only, he actually accepted the idea. Okay, he accepted the idea because of his wife's experience. So over here, his wife's experience is mentioned. Okay, this keyword over here is mentioned. His wife's experience is mentioned. That is mentioned over here. But what is the verb over here? The verb over here is he resisted the idea. That is not mentioned. The exact opposite is mentioned. What's he's saying? The only reason why he agreed to go to this offer, to this health checkup was because of his wife's experience. So that is the exact opposite of answer option A. So you should be able to eliminate A option. Okay, this is how you eliminate answer option A. And you have a suspicion that maybe B could be the right answer. Okay, so now we have one more answer option, that is C option. So now it is between B or C. All right. Now see over here, again, B, C also we can eliminate because why? Because what is C option telling? Only agreed. Okay, only agreed because his doctor advised. But as far as we heard, what was the reason? The only reason why he agreed to go to the health checkup was because of his wife's experience, not because of the doctor's advice. Right. So we can say that maybe C is not going to be the right answer. Okay. But anyway, let's just wait. Let's just wait and let's just confirm what the correct answer is. Right. So anyway, let's just keep reading. It was during his appointment. Okay, now what is the thing? Now they are talking about during his appointment, that is during the health checkup. This is not at all important to us because the question was asking when he was offered. When he was offered, how did he react? That was the only thing. We don't really want to know what happened during his appointment. So this is just a distractor. Okay, this is just a distractor. It is a useless information. It was during his appointment that based on a few symptoms, he mentioned Harry's doctor decided he need a further investigation. Okay, so this is about further investigation for prostate cancer and referred him to a specialist clinic. So this and all, this entire information over here is completely useless to us because it is during. Okay, we don't want what during the appointment. We want to know how he reacted before the appointment when he got the offer. Okay, so what is the right answer option over here? The right answer option over here is going to be B option. Okay, because he felt, okay, when he got this offer, he felt he was too healthy and he almost ignored it. He almost ignored the invitation because he felt he was too healthy, right? Now his wife's experience is mentioned. Don't you think his wife's experience is mentioned? Okay, his wife's experience is mentioned, but what is the verb over here? The verb over here is he resisted the idea. Okay, so resistance is mentioned. Okay, he resisted the idea is mentioned, but he resisted the idea because he was too fit and healthy. Okay, he did not resist the idea because of his wife's experience. Because of his wife's experience only, he agreed to go. Okay, so this is the exact opposite. The only reason why he agreed to go is because of his wife's experience, not answer option A. So A can be very easily eliminated. Now, what is answer option C telling us? C is telling because his doctor advice. The doctor is coming after a long time. That is during the consultation only. The doctor is coming. That is coming very late. And not only that, what is the verb over here? The verb over here is only agreed to attend. That is, this person over here, the only reason he agreed to attend the health checkup was because of his doctor advised. That is not the case. The only reason, okay, he agreed to attend the particular thing over here is because of his wife's experience. So this is not the reason. So answer option C is also wrong. So B is the right answer. So like this, you should be able to make the connections. Okay, this much detailed thoroughness is important. So we just have a handful of materials. So preparing for the OET is actually quite straightforward. If you prepare properly, that is again, it is not about quantity of materials. It is about the quality of materials. So just practice with high quality, and maybe you have to repeat it two, three, four times. But this is the best idea for you to become more comfortable with the OET listening. So I'll just play the audio once again. Okay, so let's just have a quick look at the audio once again. And then we will have a small discussion about the writing part as well. So every day I'll be discussing a little bit about speaking and writing. So after this, we'll have a small discussion about writing. All right, so listen, so read the question once again. Okay. Hear the audio.
So, let me tell you a bit more about my patient Harry. Like many middle-aged men, Harry was offered a routine health check at his local doctor's surgery. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. But he promised his family he'd look after himself. His wife had died of ovarian cancer some years before, so he felt obliged to go. It was during his appointment that, based on a few symptoms he mentioned, Harry's doctor decided that he'd need further investigation for prostate cancer and referred him to a specialist clinic at the hospital.
Okay, so that is what it's clear, right? So again, the app has all the detailed lectures over here in simple terms and, in Indian language translations, and why answer option B is the correct answer. Okay, why A is incorrect. Okay, why C is incorrect. Everything over here, and also set of instructions. Not, you will not be getting this anywhere else. So use it to your advantage. Right. So the reason why I'll be discussing a little bit about speaking and writing is because, the mock test, I did go through the lectures, I mean, the letters of the mock test and all. So it was, I think it could be a little bit better. So that's the main reason I'll be coming a little bit about speaking and writing almost daily. All right. So let's take a look into OET writing. Okay. And I'll just give you a very tiny tip. Okay. Not a very detailed lecture and all, just a tiny tip over here. And then after this thing is done, you can actually clarify your doubts. Okay, so regarding speaking or writing, if you have any questions, you can clarify your doubts with me. All right, so writing. All right, so just take this document over here. Right, so remember that writing is profession specific. Okay, so listening, reading, and all, it is not profession specific. Listening and reading and all is not profession specific. Everyone is basically getting the same question paper. An MBBS student is getting the same listening and reading. The nurse is also getting the same listening and reading. The dentist is also getting the same listening and reading. But over here, when it comes to writing and speaking, it is profession specific. Right. So the thing is, you need to bring in your professional judgment. Okay, so see, if you are a pharmacist, okay, and if I give you a pharmacist case note over here, okay, you can do very well because you are a pharmacist and you are getting a pharmacist case note. But if you are, let's say, a physiotherapist, okay, if you're a physiotherapist and if I'm giving you a pharmacist question paper, okay, you will have a little bit of a struggle because that is not your area of expertise. Okay, because you don't have that much, knowledge over there. So the thing over here, number one thing over here is that you should trust your medical experience over here. Okay, because this time you should not see the writing as an English writing. It is not an English test over here. It is an extension of your medical skills over here. So my suggestion over here is when you get a question paper, okay, when you get a writing question paper, you see this patient over here, right? So what's the patient name? The patient's name is Mr. Lionel Ramurthy. So you see this patient as if it is your own patient. That is, you have seen this patient in real life, you have treated this patient, and this is your own patient. Okay, and this is the situation of the patient, and these are the medical needs of the patient, and we need to improve the quality of life for the patient. So that mindset change should come. So instead, so many students, what they do is they still, okay, whenever they get a writing, they simply see this as an English language exam. Okay, they don't see this as a patient. They don't see this as a real patient over here. And they don't bring in the seriousness. They don't write with a lot of responsibility. So here you have to bring in empathy. Okay, you really need to understand, okay, this is a patient over here and the future of this patient. Okay, so based on this case note over here, you're writing a letter, right? So you're writing a discharge letter. So the future well-being of this patient is dependent upon this letter. Right. So if this letter is written very nicely, then this patient's future is safe. If this letter is not written properly, that means it has data error, it has confusing information, it has no organization. Okay, it has skipped all the important information. Okay, so when you are writing that type of letter, what happens? The patient's life is in danger because depending upon this letter only, the patient is going to get treatment in the future, right? So the patient's life is depending upon this letter. Okay, so with that responsibility, with that mindset, you should basically write a letter, even for speaking as well. So when you're doing an OET speaking also, right, there is a patient who's sitting in front of you. The medical information that you are giving is going to save the patient. So for example, if you want to talk about how to prevent bacterial complications, okay, or how to prevent post-surgical complications, and if you are speaking very casually, or if you're not giving too much importance, or you're speaking with a lot of nervousness, you're only cared about your English, what is happening? The patient is not getting life-saving information. Okay, so when you're doing an OET speaking, the patient's life is depending upon your counseling skills. Similarly, when you're writing a medical letter, the patient's life is depending on this letter. All right. So with that intention, okay, with that mindset, you should approach the writing automatically. So if this mindset is coming, then automatically your worry regarding grammar, worry regarding sentence errors, okay, that and all will fade away because your priority is the well-being of the patient. And automatically you will be able to choose the correct information because this is your patient. You care for the patient. Automatically you will be able to choose, okay, this is the information I'm writing to a person. So I'm writing to a community nurse. And the reason for writing is so and so. So therefore, this information is definitely important. This information is important. This information is not important. And I need to prioritize this. Okay, if I prioritize this, then the person will give more importance, more care for the patient. right? So you automatically every other thing will come with this small mindset change. Okay, so this is the small tip over here. When you're doing an OET speaking, when you're doing an OET writing, don't think it as an English exam. It is when you think as an English exam, then you know you a series of mistakes happening. So forget it's an English exam. See, this is a medical test. I am a medical professional. This is my patient. Okay, and it is my duty to counsel the patient properly. It is my duty to write a very good letter so that the patient's life is safe. With that intention, if you're writing and speaking, you will be able to see the difference. Right. So that is one thing. So like this, we'll be having some small discussions regarding writing and speaking every day. Right. So that is about today's lecture.